Firstly, I like to say that I'm a podiatrist, and I'm not an expert in back pain. But one thing I did see, which has been shown in various research studies in the last 10 years, is that the foot greatly affects the back. One thing I'd notice is I'd treat a patient who'd suffer from maybe heel pain or knee pain, aching legs or whatnot. They'd come back after I've used the orthotics to correct these problems and say, wow, my back feels a lot better. Now, this started to happen a lot. A real lot. So I started to look into studies which had shown some clinical proof that the foot was related to back pain in any way. Now, I'm not talking about people who've had prolapse disc or major, motor vehicle accidents. I'm talking about people who have apparently no back pathology, but their back aches generally across the lower lumbar region. And what we found is that with people like that, and particularly people who stand up all day. So you might be a person standing at a cash register, or a process worker, or someone just standing in a long period of time where the ground is very hard, and again, you get the nature versus civilization problem occurring where the foot pronates to get to the ground. And what happens is the more you pronate, the more the tibia and femur internally rotates. Now, I'll demonstrate this. If I stand in this position and I internally rotate, you get an increased curvature which drives your pelvis in an anterior position. You naturally try and increase your postural alignment to get your back straight, but you end up tightening your lower lumbar region. And if you can see here, the more curvature you get in this region, you end up getting a kyphotic compensation or an arched back in the opposite area. Again, the use of an orthotic reduces the internal rotation on the tibia and femur, and therefore allows the pelvis to reduce this anterior tilt. Now, a lot of practitioners say, do abdominal exercises, that helps, and again it does. But one of the main reasons the abdominals become weaker is because of this increased curvature. So again, you can have this chicken and egg effect, but overall I say this: if you have a tight musculature or a pathological problem, you treat that. Also, if you've got a biomechanical problem, you treat that. So again, it's holistic treatment overall for back pain. With regards to people suffering from lower back pain, one of the main considerations is excess pronation of the feet related to the hard flat ground we walk on. As you can see here, the arch is very lowered and elongated due to the excess pronation, and we have an associated internal tibial rotation which affects the femur as well as the pelvic girdle. Now, if we rotate the foot back to neutral, we change the rotation up the leg, and I want to show you the difference before and after in the hip now. So if we slowly get the patient to turn sideways and relax to the ground, so in other words, pronate, which causes the internal rotation of the tibia, the femur, we increase the anterior tilt of the pelvis in the sagittal plane, which increases again the lower lordotic curve, which, if we use an orthotic to reduce internal rotation via the foot, we externally rotate the tibia and the foot, which reduces the lordotic curve and again the strain off the lower lumbar region, and therefore assisting greatly with the reduction of low back pain.